But with that, I am going to introduce our next panel, which will answer the question, where do we go from here? And talking about lead in all sources and what we can do about them. And so the moderator for this panel will be Oliver Morrison. So I will invite him to come onto the stage. And he is the health and environment reporter for publicsource.org and recently published an investigation into the underlying causes that led to a spike in reported lead levels in Pittsburgh's drinking water. He's a graduate of Deep Springs College, the University of Oxford, and the CUNY Graduate School of Journalism, and he worked for 7 years as an educator in the Arkansas Delta before embarking on his career in journalism. Welcome, Oliver.
Thank you so much. So as we're waiting for our panelists to come on, I just wanted to do a brief introduction to talk a little bit about my perspective and what, as a journalist, I think we bring to this conversation. So I'm the health and environment reporter, and I'm very excited about this panel in particular because I think for every story I do, I never feel persuaded or convinced that it is a good story or a true story until I've been able to talk to ordinary people who are impacted by whatever the issue is. And sometimes that means talking to them directly, but oftentimes it means talking to the people that work with them directly. And so I just wanted to kind of give you some insight into how I listen to those people to try to understand what's going on, because I think it's different than maybe other people and how they listen. So if I'm talking to someone in power, for example, I might be being very skeptical of them. I might be trying to think about different ways that I could prove or disprove the things that they're saying, because I want to find different ways of holding them to account. But if I'm trying to understand how a particular issue or a particular policy like lead poisoning is actually playing out, I really want to know if it fits in with the ordinary experiences of regular people. And so for that, it means comparing what you hear people say at every level, from politicians to activists and nonprofits to ordinary people, and seeing how their actual experiences compares to what people are saying. And so when I'm listening to our panelists today, from my perspective as a journalist, what I really want to know is, and what I really want to hear are those like specific anecdotes, those specific instances that seem very true and that cut beyond the rhetoric of all different kinds, all different perspectives, so I can kind of come to understand whether or not the things different people are saying are true, how true they are, so that when I get to the writing stage, I can sort through all that. So anyways, I just wanted to give you a little perspective. That's the journalist perspective that I hope I'm bringing as a moderator today, but I'm very excited to be hearing from the people who work with people impacted by this issue, because to me, that's always where the gold lies in the reporting process. So to start us off today, we're going to just ask a really general question of them all about what they do to advance lead poisoning locally. So we just want to sort of have you introduce yourself and what is the work that you've been doing. So we'll start off with Juanita Brown. Juanita, are you there? Can you go ahead and start us off?
Yes, I'm here. Good morning. I'm Juanita Brown. I'm a registered nurse that works for Allegheny County Health Department in the lead department. And my job is, as the health department receives results of elevated blood lead levels for children in our county, is to reach out to the families directly and provide one-on-one education on what resources are available, what lead is, kind of explaining what the results meant, and then offering the health department services, which is a lead risk assessment at no charge for those families affected by elevated blood lead levels. So that is my role, is a lot of more that one-on-one direct contact with the families, and as I'm able to also assist with tabling events to try and get information out to the general public.
Great, thank you. Curtis, do you want to go next?
Sure, happy to be here. My name is Curtis Devon. I'm the West PA Organizing Director from Clean Water Action. Essentially, what we do to fight the lead poisoning prevention is empower and advocate. As of recent, on a local level, we just met with Wilkinsburg Penn Joint Water Authority. We had a very productive meeting, in my opinion, with them. And specifically, we talked about things such as lead service line replacements. In particular, making sure that those are equitable and making sure that not only the public side is being facilitated, but also the private side. In addition, we also work with supporting and doing anything possible with continuing the movement that is going on with the lead ordinance. We just had a press conference yesterday with a couple other members that are also joining us today during this event. So basically, in a nutshell, that's what we do to try to empower and to advocate for a positive change for everyone.
Great, thanks so much. And can we go to Becca next?
Hi, happy to be here. So yeah, I'm Becca Simon. I'm the project manager, policy and land stewardship at Grounded Strategies. At Grounded Strategies, we work to improve the social, economic, and environmental health of distressed and transitional communities by building capacity to reclaim vacant, underutilized land. So when we're talking about lead poisoning prevention, we're looking at the risk of lead most commonly when working in communities that are most impacted by high numbers of city-owned and privately owned vacant lots. Many vacant lots have high levels of lead in the soil due to demolition of houses in the past that were not safe, and also weathering of lead and paint into the soil. So what we're currently doing is working in neighborhoods like Hilltop and Allentown, where they're experiencing higher rates of lead-related health due to these demolition practices. We're working directly with Abiding Missions, a local nonprofit in the neighborhood of Allentown, to engage and remediate a test plot of soil as an act of trying to understand better ways to maintain vacant lots instead of just letting high levels of lead sit on these vacant lots. So enabling uses of products such as biochar, which is a super burned carbon material, to try to reduce the toxicity in lead or in soil, while also engaging directly with the community through Abiding Missions and 4-H and working with students and children in the neighborhood to talk about the importance of soil health and also possible exposure rates of lead too. So working with them can make those connections between environmental health and directly trying to also improve green spaces.
Thank you. And Hannah, do you want to go next?
Yeah, sorry, I had to find the unmute. Yeah, thank you. And I'm also very excited to be here and be a part of the summit today. We've been able to hear from a lot of amazing panelists so far. So my name's Hannah Beatley. I am the Healthy Homes Program Manager at Women for a Healthy Environment. And we are an environmental public health nonprofit, but we are working on lead and other environmental hazards across different sectors and program areas. So through our Healthy Homes Program specifically, we provide education and workshops and partnerships with community organizations, technical assistance for families that are dealing with lead poisoning issues or other healthy housing issues. We provide what we call healthy home assessments and kind of walk through the home environment and think of different environmental triggers and how we can help families address them. And through that, we provide resources like water filters and cleaning kits and other healthy home resources. But at Women for Healthy Environment, we also have a Healthy Schools and Healthy Early Learning program, and they provide technical assistance and resources like our 1,000 Hours a Year initiative, which provides free lead and radon testing and remediation services for schools and early learning centers in southwestern PA. We, WHE, Women for Healthy Environment, is also advancing primary prevention policy through our partnership, like Curtis had mentioned, through the Get the Lead Out Pittsburgh campaign and through our coordination of the Lead Safe Allegheny Coalition, which is the host for the summit today. So we've done various pilot projects, different initiatives through the campaign and the coalition, but right now we are currently providing free proactive lead risk assessments for families in Allegheny County so that people have the opportunity to test their homes before they have a child with an elevated blood lead level. And so thank you, Oliver.
Thank you so much. And Anna, why don't you finish us off?
Cool. Thanks. I'm Anna Coleman. I'm the environmental justice organizer at Pittsburgh United, and I coordinate the Our Water campaign. And the Our Water campaign works on a variety of issues related to water, but underlining it all is the belief that all people deserve access to public, safe, and affordable water. So that has brought us into work with a bunch of different areas, but including working with PWSA and increasingly, as other people have talked about, working with Wilkinsburg Penn Joint. And the campaign came from kind of two different areas, working on clean rivers and that area of environmental work, as well as then working with water authorities. And so together it really combines this idea of water connected through our built environment and the rivers surrounding our city, as well as then more of the utility side of it. So it's kind of this whole holistic idea of how water connects to the way that people live and are able to live in a just and safe way.
Great. So we have a really wide variety of perspectives here, and I'm very interested in hearing from each of you about, since you're all involved in some capacity, in your role, what are the tough spots? What are the obstacles you find yourself bumping into in order to do your job as effectively as you want and in order to reduce lead poisoning locally? And feel free to just jump in.
I can take a first stab at it. Just in our experiences working with families through our partnerships with the family centers and different community-based organizations. I think one of the things that we notice, we try to be as resource heavy as possible, but something that in Allegheny County, we only have one right now funding stream for lead-based paint remediation, and that's through our HUD-funded program, Lead Safe Homes program, which is a really great program that is specifically designed to give both homeowners and renters the opportunity to have a certified contractor come in and do lead-based paint remediation. However, that's very one small pocket of money. And right now, there's really not a whole lot of remediation funding that we can point both landlords, tenants, and homeowners to. So I know that's something that while we're trying to be proactive in our testing, that's something that we keep, kind of running into in terms of, trying to identify different streams and different avenues for remediation funding.
I would agree with Hannah. I see that often as well. One of the challenges in trying to get some of the families that I reach out to agree to a risk assessment in the first place, though sometimes, as a previous panel had kind of addressed, I have families that say, my family has lived in this house for, many years and nobody ever had any issues before. And just kind of that belief that this is just how it is, or we know the water's not good, so we just don't drink it. We drink bottled water, and maybe just don't recognize the value of the assessment, or knowing that even if the assessment is done, the funding isn't available to make the necessary big changes. So I would say sometimes belief systems and then the funding sources for remediation work are two of the biggest challenges I find.
And I can chime in right after that, because for me, it's people seeing the correlation and understanding the seriousness and dangerousness of lead, and that 0% of lead is acceptable. I also believe I hold a unique perspective in this matter because, as I stated earlier, I'm the West PA Organizing Director for Clean Water Action. However, in my previous job, I worked with children in Lincoln Elementary School and Homewood, Lincoln Lamar area. And I say a unique position because I feel like I kind of get to see it 365, how lead can affect people. And to me, it comes out to a formulaic equation. So we're all familiar with, or I hope at least we've heard before, the prison pipeline system. And if we look into the effects that lead gives our children, especially our young, ADHD, other mental behaviors like that, and then you take that and you drop them into a school setting, which I was able to be prevalent of, and see the day in and day out of how that correlates, and see how some teachers are not relating to the kids because they're thinking the kids are just being disrupted to be disruptive, whereas these kids are being exposed to lead at early ages and they're not able to develop the core skills that they need in order to thrive and listen in school. And what's happening is they're being deterred into other areas. And unfortunately, those other areas, once we progress in age, if not correct, it can lead us into prison. It could lead us into the grave or into a situation that we don't want to put ourselves into. So just everyone taking it serious and knowing just how important this situation is.
Yeah, and I just want to bounce off what Curtis is saying. You know, like any level of lead exposure to a child is unsafe. It doesn't matter how low, how high, it is dangerous for a child. In our work, you know, some of the biggest struggles and obstacles we face is that like children deserve green spaces. They deserve lots. They deserve places to play, interact, have fun. But we live in a city and a county with 30,000 city or vacant lots in the city, 60,000 in the county, and 13,000 of those lots being city owned within Pittsburgh. And many of these vacant lots we found have high levels of lead. And it's not fair for many communities that often face higher levels of vacant lots in their communities to also be facing these higher levels of lead. And if you are trying to steward those lots too through anything like the adopt a lot process, if you face soil testing and see that there's over 1,000 parts per million of lead in that lot, it is no longer accessible. There's no way to access that lot. And if that is the only accessible lot right in your block, what are you supposed to do? How do you prevent kids from running on that lot, from playing in it? Anytime a child or a person walks through a lead filled lot, even if it's covered with mulch or grass, like there's still going to be dirt on the bottom of their shoes. They're going to track it into their homes. It's going to become dust. Like it is still a hazard no matter what. We can't just keep letting these sit. We need to be working together with communities to be coming up with solutions, remediation process, especially with soil. There's so much to be done, and that can be turned into these amazing vacant lots. Lots have stories, they have history. We need to be working together to rebuild them.
Yeah, and I think with what Becca was just saying, like a lot of the areas in which lead can influence people's lives is these like very basic needs. So in your home and places you children want to play, and then with water, which is what I can speak more to. And so surrounding water specifically, there's this idea that a lot of advocates have been pushing for, that it is with water as a human right, that it is something that everyone deserves, that it be something that's safe for people to be able to consume without stress or without having to be exposed to these potential negative side effects. And I think to have real progress on a lot of these issues, it's kind of shifting the way that we think about how we have access to homes and have access to safe space and water, and that these aren't things that need to be commodified, but are things that everyone deserves. And there's a lot of ramifications and ways that needs to be further pushed. But I think underlying a lot of stalling in progress on lead is just the fact that people don't see a lot of these things as basic things that all people deserve, but things that people are having to like work for or deserve. And that's kind of where a lot of the holdups are.
Great, thank you all. And Carol Hardiman is here with us. Carol, could you just introduce yourself and the work that you've done around lead? And we're discussing right now, what are one of the main obstacles that you see in continuing to further that work?
Sure. Good morning. My name is Carol Hardiman, and I'm the Executive Director of the Hill District Consensus Group. And thank you for inviting me to be on the panel. And what I see the most is tenants don't, it's a lot of lack of education, and plus it's landlord intimidation, right? Because most renters and homeowners, they don't always know their rights around what they need to know, or in particular, bringing a landlord or asking a landlord a question about, is my home lead free? Is, this a safe environment, for my kids? And what I see is a lack of education, and also a little bit of landlord intimidation, because most tenants are afraid to speak up, right? Because they want a roof over their head. And if they feel like if they bring these issues to the surface, that they're going to get evicted or they're going to be punished in some kind of way that it's really not their fault. So I think tenants in particular need a right to know policy clause in their lease, that you have a right to know this if you bring this question up, and we need to provide you with the information. We kind of posed that question when we were working with the Hands Off Our Water campaign about 3-4 years ago, and we questioned the housing authority and other major property owners. And so, you know, the only property owner that was really able to provide us with information was the housing authority. But other landlords, you know, they didn't have any information for us to even pass along. You see what I'm saying? So imagine if you're paying rent and you don't even know that about lead paint, lead water, and everything that's going on, in particular, a public subsidized unit, then they have the right to know. And reason why I brought up a lot of homeowners, some of them have inherited old homes, right, from families. And they don't really know if they have lead in there because, you know, right now everybody's trying to survive because of COVID and so on and so on. And so some of these homes, they still had the paint from the 60s in the wallpaper, you know what I mean? And the wood paneling and, you know, covering up the lead. So it's just, the government doesn't work well, or the policymakers doesn't work well with the community when we're out there trying to educate and trying to provide water filters and things that people need, on top of people not understanding their rights and they're not educated about what lead really, how it really is affecting them, you know. So
thank you, Carol. That's really great. I think what we heard from Carol and several of you is that a lot of people have sort of misinformation or a lack of information about the issue. And since this is a panel, we're trying to learn from some of the solutions you guys are already implementing. What has been effective for you in trying to convince people or inform people that this is an important issue and that they should take action? Like what has worked in your communication with people? And if you can provide a specific example as a journalist, I'd love it. But if not, just please generalize. What works for you?
I can start off. Something that's really worked for us is really just working from a bottom-up approach. I feel like anything with top-down approaches right now, it's not engaging the community it needs to. You're not actually reaching anyone. And so finding solutions within is the most important step. What we do with our work, and especially in Allentown, is working directly with all ages on these issues. Kids can learn about these things. It's not just something that they need to think of as a mystery. It should be directly involving them. We work directly with 4-H, which is their agriculture and environmental club at Abiding Mission, working with kids from ages 5 up to 16, talking about soil health and the importance of that, and also how that relates to lead exposure. We work with them to talk about the lot right next to Abiding Missions. What does that mean for them if there is exposure? What are ways that we can work towards coming up with solutions to make this little lot a space that they can all interact with? Right now, we've really built out that biochar process together with the kids. We do soil sampling to show them this is how it's done. This is what needs to be done. These are the results that we're finding. And they're directly part of that. And we talk about the importance of washing your hands after being on these lots, or engaging other kids in the neighborhood about being careful around these spaces, but also not trying to increase fear about the importance of soil health. Chaplain Christine's done a really wonderful job of turning that space into a connection to the environment. She's, been bringing in chickens. She's been letting us do a perennial garden out there, just showing that these spaces can be a new future too. and that we are able to develop and create spaces together, which is really beautiful in my mind.
I know in my work, being that I'm often having conversations anywhere from, half hour to an hour with some families, going through the lead risk assessment questionnaire, I really do try and listen to the families' concerns, try and get their feedback whenever possible, and then allow that to change or affect my work. For example, some of the information that I shared last year when I would follow up with families, having gone from joint home visit with the inspector to, during COVID, having to do more of or offering families the opportunity to do the questionnaire over the phone to limit exposure, and then only having to have one person in the home at the time of the inspection. So having those conversations with these families, kind of listening and changing some of the questions or adding to some of the questions that I had previously asked, maybe including another potential source that someone brought up, or because of somebody's concern, I'm trying to include additional resources or information that I didn't previously, such as maybe like second or third hand smoke exposure, pica for children with autism, and things like that. So just listening to the family's concerns and then trying to find resources to address those concerns with other families should those concerns arise again.
Yeah, Juanita, I think you bring up a really good point. And I think Oliver, something that all of us, I think, are dealing with is that many people, assume that lead is an issue, of the past. That's something we dealt with already, or that's something that I don't have to worry about. And I think another thing that, sometimes we have to navigate through is, well, my grandma lived in this house forever and she's totally fine, or like that kind of, anecdotal storytelling around, everybody's dealt with it and everybody's okay. I think it is partly, around like how you bring this issue and make it personal. So everybody is impacted by lead across the lifespan, whether that's if you yourself have been impacted or been poisoned, or if you have a child or a grandchild or a niece or a nephew, or, we all live, or well, most of us live in a county or in a city with a lot of old infrastructure. So if we can make that tie in, we're all dealing with this. We're all dealing with deteriorated housing, chipping and peeling paint. We're all dealing with this issue. If we can kind of make that personal attachment, how, and really pull that into, ask in the beginning of a session, when was your home built? And more than 80% of people are probably going to say before 1978. Then it no longer feels like an issue that, okay, that's something that, I can tackle. And I know a second part to that, how we've been able to do that a little bit more effectively is doing that in partnership with, community partners and within settings where people, feel like they're being heard and they're with a trusted community champion. And so, if you're in a session and your pastor, or if you're in a session and the director of your family support center is saying, this is something we need to take seriously, then you get a little bit more buy-in. So I know we've had a lot of, great success delivering those messages in partnership with trusted community partners as well.
Well, I can add on to what Hannah was saying as far as personal, because I think that's really a key element. And so when I think about it, I think about connecting and educating. As far as something specific that we were able to be a partner of, which was the Wilkinsburg Penn Joint rally, I think that was highly efficient, because from the rally, we were directly able, along with some other partners, to have a meeting with the Wilkinsburg Penn Joint. That was directly effective. We had people from the community come out, we had them speak up, and we had the executive director from Wilkinsburg Penn Joint actually commit to giving us a meeting. Highly effective. Another thing that I think of, and I harp on the word effective, is Clean Water Action is working with some state legislators to introduce an environmental justice bill, which would kind of put a stop to the permits that these developers are accessing that are causing these problems in our neighborhood. And I hone in on the personal aspect because part of this bill is being headed by Representative Bullock, who is located in the Philadelphia region. But two very important things that I think to mention is she is the head of the Black Caucus, and that her child actually suffered from lead poisoning. So it's very personal to her and all the other people involved. And the reason why I bring up the importance of the Black Caucus is for surely a lot of us live in houses that previous family members owned. I happen to be one of them. And that's more prevalent or most prevalent in African-American low-income communities, because individuals like myself cannot necessarily have the funds to necessarily venture off and go some places. So what it looks like is being stuck or residing in the homes that we were raised in. And so when I think about effective ways, I'm really excited about this state legislation, because as I said, it hits home, on a lot of fronts. Not only has Representative Bullock's kid been affected by it, but it is set in place to stop organizations and entities continuing and exacerbating an already prevalent problem.
Just to speak to that, when you mentioned about kind of living in family-owned homes, that actually has been another barrier that I've come across on occasion, in that some of the multi-generational homes, in speaking with the parent of the child, sometimes they will express interest in having a lead risk assessment, but because they don't own the home, they're having to check with their mother or grandparent, whoever it might be, that's the actual homeowner, and then coming up against some resistance that they don't really want to have that done. And I try whenever possible to provide that education, that even though maybe their children or other grandchildren have not been affected, one of the examples that I use often is that our inspectors have seen cases of even twins being tested, where one might test high and the other test within normal range, and how it really has to do with that individual child's behavior. So if one tends to be more of a thumb sucker or nail biter, that increased hand-to-mouth motion or activity increases the risk. So just to kind of differentiate how every child is different, even within the same household, even among cases of twins.
I just want to say also, what we did and we still do, first of all, this work is connected to health, housing, the sectors, first of all, and, going back to what the consensus group did and still do, we really educate, and we have workshops. And I remember, we were doing a workshop with the schools and basically the community, and it was led by Pitt, University of Pittsburgh, and they wanted to do these STEAM programs. And so, of course, when people, or in our community, most of the people may think, well, okay, I'm not really down with this thing because it doesn't speak to me. But as a social justice effort, I said STEAM needs to relate to the social justice side as well, because, it speaks to lead, it speaks to the environmental justice, it speaks to all of those things as well. So they said, oh, that's interesting. I said, yeah, because we focus just on science. And that is a science, because you need scientists to help you think this through, and as well as, environment. And the T could be a teaching moment. So we went on, we had that panel as well. So we been partnering with schools to try to get that on the curriculum because, you know, a lot of parents don't understand what their children are being taught, right? And children, they're our first, well, parents are the first teachers, but really children are the second because, you know, vice versa, we're learning things from them that we never learned. And then going back to the policy piece and people living in homes that they inherited from relatives. And I guess, you know, the homes are, most of them are 100 years old. Who has that kind of money to redo, like tear wood paneling down and drop ceilings down? And, you know, because I live in a home like that, right? I'm in my mom's former bedroom, and a year ago, it was panel. It was like if these walls could talk. But I had to get something done because the roof fell in, right? And so when the contractor pulled stuff, it was like tons of wallpaper and tons of just peeling paint behind the paneling, right? And it was scary to me. I mean, even though it's beautiful now, but I said, wow, you know, you just never really think of the layers and layers and layers of paint on top of people back then put beautiful wallpaper and then the paneling. That's all behind, you know, these walls. And a lot of these older homes in particular, that's what they're made of. But who has that kind of money laying around to redo their home, let alone? So I've been having an idea about, okay, this American Rescue Plan money, they keep saying it's to fix and preserve. We need to be on board with that, you know, and I get that, you know, in the Pittsburgh area, what I didn't get, there was a lot of community engagement at all. And so, you know, of course, the advocates, we showed up at the council meetings, right? But we needed the community, the other groups around us. I would say the food groups were there the most, and the housing. But I was just thinking, what about the people that, you know, their kids need clean water. I just thought about all the micro stuff under the macro, right? And so, you know, I was told by one councilman.
Can I interrupt really quickly, because we're running out of time, and I just want, you hit on something that I want to make sure that everyone gets a chance to respond to. You brought up the American Rescue Plan, and I like all of you have mentioned some just really interesting examples of things that you do to make your work more effective. I wanted to hit on other examples, like Carol mentioned, of aspirational ways that you could move the issue forward. How could you be more effective? And that could be a collaboration with another group that you know about or have heard about, or the government, or maybe that is some sort of help from a local government or federal government entity. And since we're running out of time, just try to keep your answer to a minute or less. What is the thing that you most think would move this issue forward, either collaborating or from the government?
Funding. And I'll pass it on. It's money all day, every day.
Good.
I can go really quickly, and I know that this is something that we locally are, you know, advancing toward. But I think, you know, the afternoon we're going to talk a lot about primary prevention policy, and I really do think that, you know, the best way to advance, you know, lead poisoning prevention is really through engaging our local leaders and policymakers and making this a priority within, you know, what we're passing in terms of proactive rental inspections, in terms of lead safe demolition, in terms of, you know, lead safe or full lead service line replacements. And so really thinking about lead across all sources of exposure and making that a priority in our policy agendas. And I really do think that we're moving in a better direction, specifically here in Pittsburgh, too.
Yeah, I can just chime in and echo what Hannah and Carol said, where so much of what seems to slow down progress is funding. We're talking with water authorities and the difficulties they have in being able to do full line replacements, where even if it's what they're leaning towards and know that they should be doing, having funding that is contingent on doing that, and having funding that just requires that that is the way that it is done, and then is able to be provided in a way that is meaningful enough for authorities to actually be able to do it, is like really crucial, and just like a huge roadblock that once it's addressed, a lot of progress can be immediately made.
I wholeheartedly believe what everybody else said, which is funding. I guess as an aside to that, I would also offer collaboration, especially with the environmental justice bill that I just mentioned. It just was like rolled out yesterday, so it's fairly new. Also, I know Clean Water Action has been partnering with Women for Healthy Environment to do other endeavors, Pittsburgh United, and we're open to working with whoever else. And lastly, I'll say just engaging the leaders and making sure that those leaders are held responsible and that they answer to, because we get into situations where you can do all the reach out that you can and connect with the people, and we have them ready, but the leaders that say they want to represent these areas do not respond.
I agree with the previous panelists. Collaboration is key, especially there's so many different players already involved in trying to make some changes. So we just need to try and work together to keep from duplicating some efforts unnecessarily. And then just continue to identify additional outlets for dissemination of information. Like I know, let's say Allegheny has done, trying to reach out to do-it-yourselfers, certain hardware stores, or expectant parents, and not waiting until that first elevated test at 9 months, but really trying to reach the pregnant woman and even before pregnancy, just women of childbearing age that could potentially be exposed and affected by this issue.
Yeah, just going to echo everyone. Funding, collaboration, always first most. We need it. Continuously need to be talking about it too. But just also like looking at things like the upcoming lead safety law, making sure that like those standards are actually upheld and that people are following through on that. They're hopefully, we're looking forward to next week and seeing how that goes. So shout out to Get the Lead Out and Let's Save Allegheny for all the amazing work on that.
All right. As we're wrapping up here, I just wanted to thank all of our panelists for your incredible insight. There are so many things that people said today that are going to stick with me. I think one of the ones that stands to the fore as I try to think about how to communicate this issue better is just having twins in a house, and one could have high lead levels and one doesn't. And sometimes the power of those images to communicate, okay, well, maybe you didn't have an issue. Maybe the other person in this house didn't. Maybe that is true. But we know that even when you have twins with nearly the same genetics living in the same environment, one person can get that impact and one person can't. That's a really powerful image. So thank you all, our panelists. There's so many different things you said that are going to stick with me. And I'll turn this back over to Women for a Healthy Environment. Thank you.